Okay, well, I will go ahead and get started. Thank you everyone who has joined us today, Mount Ararat Baptist Church and the Mount Ararat Counseling Center. Thank you very much. Today's topic is managing your mental health during the COVID-19 pandemic. So let me give you an overview and a rationale for this webinar today. First, May is Mental Health Awareness Month. And so this couldn't have come at a better time with us going through this coronavirus pandemic so that we could really focus on mental health and the strategies to manage your mental health, but also understanding some of the signs and symptoms of different types of mental health challenges. Coronavirus disease has really shined a light on mental health issues. I think it's really important to understand that mental health challenges and mental illness was going on way before the coronavirus disease and the pandemic. But this pandemic has just shined the light on many issues that are going on with people. And I'll talk about some of the common reactions to the coronavirus in just a couple of slides. I do also want to point out, I was just sent an article just a few minutes ago regarding a study that just came out today. And the title is the article is titled, Yale study says devastating health effects from COVID-19 will last for decades. A new study conducted by the Yale School of Public Health warns that long-term mental and physical public health consequences of the coronavirus pandemic of 2020 will likely be felt for years and even decades to come. So really, I should change the title of this webinar to Managing Your Mental Health During and After the COVID-19 pandemic, because there are going to be long-lasting effects from this pandemic on mental and physical health. I also want to kind of come from a passage, John 5:6 in the King James Version, and this passage is focusing on the healing at the pool. And it says in the scripture, when Jesus saw him lie and knew that he had been now a long time in that case, he said unto him, wilt thou be made whole? And part of this webinar is about, wilt thou be made whole? Sozo, S-O-Z-O, as a concept, is connected to the Hebrew shalom. Shalom is physical, psychological, social, spiritual well-being. So healing is more than just your physical transformation. Healing is mind, body, and soul. Wellness, it refers to a holistic approach in which mind, body, spirit are integrated. It is a way of life oriented towards optimal health and well-being in which the mind, body, and spirit are integrated into a purposeful manner with a goal of living life more fully. So when we talk about, and you hear this idea of wellness and total health and wellness is spiritual wellness, social wellness. Are you engaged in a support network? Do you feel like you have a sense of connection and belonging? Financial, this is satisfaction with the current and future financial situations. Emotional, environmental, which is the community and your household. Intellectual, recognizing creative abilities and finding ways to expand knowledge and skills. And then also your physical health. And as you will see from this model, every aspect, each dimension overlaps with each other. So if there is something going on financially, it's going to impact emotionally, it's going to impact socially. And so when we talk about wellness, it's more than just an absence of disease, it's a state defined as health. So that's why you will hear total health and wellness. and incorporates a concern for optimal functioning within the dimensions of wellness. Wellness also includes mental health, and mental health is defined as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. The National Institute of Mental Health has reported that only about 17% of US adults are considered to be in a state of optimal mental health, being able to manage the whole aspect of wellness. And there is evidence that positive mental health is associated with improved health outcomes. So it's really important to understand that mental health is one aspect of the health and wellness model. And when we talk about health, it's a holistic health. So when we ask you the question, wilt thou be made whole? Are you willing to work on each of these dimensions of wellness that include your mental health to be able to be made whole? When we talk about mental health, let me give you some statistics. The National Alliance of Mental Health has put out a publication. 1 in 5 US adults, 1 in 5, experience mental illness. A mental illness is a mental, behavioral, or emotional disorder, and it can range from mild to no impairment to mild, moderate, and even severe impairment. We have 1 in 25 US adults experience serious mental illness. And this is defined as a mental, behavior, or emotional disorder resulting in serious functional impairment, which substantially interferes with or limits one or more major life activities. So somebody who may be suffering from a serious mental illness, it's debilitating. They're not able to function at work. They're not able to function at home or in the community. Somebody who has a serious mental illness may be on disability. And then I also think it's important, we cannot forget our youth. We can start diagnosing young people with a diagnosable mental illness starting at the age of 6 years old. 17% of youth ages 6 to 17 experience a mental health disorder. 16% of Black adults experience a mental disorder and any mental illness. 17% of the Latinx population, 15% of Asian adults, 22% of Alaskan Native, and 27% of those who are mixed or multiracial. And then we talk about 19% of all adults in a 12-month prevalence of any mental illness. And when we talk about mental illness, we could be talking about depression. We could talk about post-traumatic stress disorder, anxiety, bipolar disorder. We could also be talking about borderline personality disorder, to give you some examples. Now, these statistics, these are based on research. We also have to keep in mind the numbers could be different because there are those that don't participate in research studies, so we might not be capturing them all. But if we use what's based on research, 1 in 5 US adults experience mental illness. So what does this mean for the COVID-19 pandemic? What are some of the common reactions? Uncertainty about future. What's going to happen with my job? What's going to happen with school? I'm supposed to be going to school this fall, whether it's K through 12 or pre-K through 12, whether it's college. Is school going to be online? So there's this worry, there's fear of getting sick or fear of family members getting sick, fear of the economy opening up and people not wearing masks and I have to go to the grocery store. There's fear about where's my finances going to come from because I've been furloughed or laid off from my job. Other reactions include just trying to make meaning and what is the purpose of all of this? So these inner conflicts and anxiety. There's a concern about feeling isolated. When we talk about social distancing, we've been trying to communicate social distancing doesn't mean social isolation, but this is a concern, especially if somebody lives alone or lives in a community setting that does not allow for visitors. Other results and common reactions to COVID, increased substance use and abuse. There's been a significant increase in domestic violence. There's a feeling of guilt. Guilt if loved ones help them with activities of daily living. Guilt that I'm working and my other family member is not working. So there's some guilt that is common reactions. And then there's also an increase of distress, anxiety, depression, trauma-related symptoms. And these are especially true if one has had pre-existing mental health concerns before the outbreak. That's why I said it's really important to understand that mental health challenges and mental illness was happening way before COVID. But COVID could also be a further trigger of some of these pre-existing issues. So let me talk about some of the issues. Trauma. Trauma occurs when a person is overwhelmed by events or circumstances and responds with intense fear, horror, helplessness, and extreme stress overwhelms the person's capacity to cope. There is a direct correlation between trauma and physical health conditions such as high blood pressure, diabetes, heart disease. An individual trauma results from an event or series of events or circumstances that is experienced by an individual as physically or emotionally harmful for life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and spiritual well-being. So trauma can stem from war, other forms of violence, medical intervention. So some people could be experiencing trauma just from medical interventions, anything that's going on with the coronavirus and having to get treatment. Trauma can come from abuse, physical, emotional abuse, and trauma can also come from this pandemic. This pandemic is triggering grief and loss. This pandemic is triggering the fear. So this pandemic in itself is a form of a trauma. How common is trauma? 70% of adults in the US have experienced some type of traumatic event at least once in their lives. In the United States, 61% of men and 51% of women report exposure to at least one lifetime traumatic event. More than 33% of youth exposed to community violence will experience post-traumatic stress disorder, a very severe reaction to traumatic events, and I'll talk about PTSD in just a moment. And trauma is an equal opportunity experience. It does not discriminate. It has no boundaries with regard to age, gender, socioeconomic status, race, ethnicity, sexual orientation, or any other cultural aspect. And trauma is a common experience for adults and children in American communities, and it is especially common in the lives of people with mental and substance use disorders. Stress. Stress is an emotionally bodily reaction to physical, psychological, and emotional demands. So somebody who's beginning to get stressed because of external factors or expectations they place on themselves or expectations they place on others, there could be stress from the physical environment, the context, the community. And then stress is just this force or system of forces that tend to strain or deform the body. So again, wilt thou be made whole? Will you manage the stressors? And my way of kind of thinking about it is if this water bottle was a Pepsi bottle and we shook it up, there is a lot of stress in this bottle. And so we have to let the cap out to let the air out, because if we don't, if we just take the cap off, the stress, the Pepsi is just gonna explode. And if we hold it all in, it's impacting a person's physical health and can cause some internal physical pain, which I'll talk about. Some of the stress can come from pressure from work, frustrations, perceived lack of time to meet demands. Right now, people are working from home and trying to manage having time set aside for work, time set aside for family, time set aside for self, and it's all blending in. So part of this stress can come from this lack of time, difficulty making decisions, social pressure, there could be this idea of, I don't have any control of what's going on and I want to be in control. And as we just can't control with what's going on with the pandemic, but that can cause some stress. People pleasing, worrying about how others perceive you, your own self-esteem, that can impact and cause stress, the self-efficacy. Stress is a survival mechanism used to respond to perceived dangers. So when you start feeling stress in your body, then that becomes a red flag to say, I need to come up with some skills and some strategies to manage this stress. So it's a powerful internal communication to raise awareness. So it's really important not to ignore those signs of stress. Now, for some people, stress can be a source of energy due to the release of hormones secreted during the physiological stress response. So some people have an excess of coping strategies and can manage that stress and can be used as a source of energy. But when the stress exceeds coping strategies, when the stress starts to impact the body and deform the body, that's when it becomes a red flag. Post-traumatic stress disorder is a mental health condition that's triggered by a terrifying event. This pandemic can be a terrifying event, exposure to actual or threatened death, serious injury, sexual violence, and it can happen by directly experiencing the traumatic event, but it could also be indirectly experiencing the traumatic event, knowing somebody who has gotten sick, or knowing somebody who has died, or witnessing the abuse, or experiencing the abuse directly, witnessing violence, or constantly watching the news and hearing about oppression and discrimination. There's this thing called race-based traumatic stress. And so watching the news or hearing about the violence or hearing about the sickness can be traumatic. Witnessing in person the event as it has occurred to others. Learning that the traumatic event occurred to a close family member or close friend. In case of actual or threatened death of a family member or friend, the event must have been violent or accidental. And then fourth, experiencing repeated or extreme exposure to aversive details of the traumatic event. So this is, you know, when we think about first responders, when we think about counselors, when we think about police officers, and they're repeatedly exposed to the details of this trauma. So that's where, when we're talking about helping professionals, whether it's those spiritual leaders in the church, whether it's pastors, whether it's counselors, we have to be aware of what's called secondary traumatic stress or compassion fatigue, which is a feeling of chronic stress, emotional exhaustion, and tension often felt when experiencing and being in close contact and hearing stories of the abuse. One of the things I've been really worried about with a lot of pastors and ministers with the number of deaths from the COVID-19 pandemic is just making sure pastors, with having to conduct these funerals and conduct them in different ways and these memorials, that they're taking care of themselves as to prevent compassion fatigue. So I've talked about trauma, I've talked about stress, PTSD. What are some of those signs and symptoms of trauma and stress? So when I was talking about deforming the body and just holding in that stress, it can be psychosomatic. There could be headaches, there could be backaches, stomach aches, there could be digestive issues, and that it cannot be explained by any other physical diagnosis. There could be sudden sweating and heart palpitations, changes in sleep patterns or changes in appetite, easily startled by noises or unexpected touch. I know that there have been some people that are who have experienced trauma where when the phone rings, they're worried about it being some bad news. So they're easily startled by a phone call. People are more susceptible to colds and illnesses, worsening of chronic health problems. There's fear and worry about your own health and health of loved ones. And then there's some worsening of mental health conditions for those that have pre-existing mental health. Other signs and symptoms: irritation, anger, outburst of anger or rage, denial, feeling uncertain, nervous, or anxious, feeling helpless or powerless, lacking motivation. So now those things that you found exciting in your life that are normal activities, you're now not engaging in those normal activities. There's a tendency to isolate yourself. There could be self-blame or survival guilt. There's trouble concentrating. This is a major sign and symptom that I've been hearing from people. I'm struggling with concentrating. This wasn't an issue before COVID started. This wasn't an issue before the pandemic. But because of the pandemic and just this worry about health and what's happening in our economy, it can have an impact on a person's ability to concentrate. Now let's talk about anxiety. I think it's important to understand some anxiety is normal. Occasional anxiety is a normal part of life. You might worry about things like health, money, or family problems. It helps one to deal with tense situations, whether at work, whether at school, whether with the kids, with the family. In general, it helps one to cope. But when anxiety gets in the way of your daily functioning, when anxiety becomes an excessive, irrational dread of everyday situation, it has become a disabling disorder. Some people may be diagnosed with generalized anxiety disorder. They feel extremely worried or feel nervous about things and these other things, and there's no reason or little reason to worry about them. So people with generalized anxiety disorder find it difficult to control their anxiety and stay focused on daily tasks. Anxiety affects about 40 million American adults, 18% in a given year. It causes individuals to be filled with excessive irrational fearfulness, dread, and uncertainty, as I said. It lasts at least 6 months and can get worse if not treated. It can occur with other mental and physical illnesses, such as alcohol or substance abuse. And the alcohol and substance abuse may mask the anxiety symptoms or make them worse. In some cases, other illnesses need to be treated before a person will respond to treatment for the anxiety disorder. Depression is a normal phase of living for millions. Sadness, feeling down, bereavement, and feeling depressed are all part of the human condition. Most people over their lifetime experience some degree of depression, some much more than others. Some of the signs and symptoms of depression: persistent, sad, or empty mood, feelings of hopelessness, feelings of guilt, worthlessness, helplessness, loss of interest or pleasure in hobbies, decreased energy, fatigue, being slowed down. Some of those signs and symptoms that I mentioned for trauma and stress, sleeping too much, not sleeping at all, changes in appetite. There could be thoughts of death or suicide, and that's really important to recognize these signs for depression. Especially if there's thoughts and signs of suicide, it is really important to understand it is okay to talk about suicides. Thoughts of giving up and suicide can be frightening. Not taking these kinds of thoughts seriously can have devastating outcomes. Again, the National Alliance of Mental Illness has reported that suicide is the second leading cause of death for people ages 10 through 34, 10 years old to 34. The overall suicide rate has increased 31% since 2001. Suicide is the 10th leading cause of death in the United States. And 46% of people who die by suicide have a diagnosed mental health condition. And 90% of people who die by suicide have experienced symptoms of a mental health condition. So it is okay to talk about it. And we have to talk about depression. We have to talk about anxiety. We need to talk about post-traumatic stress syndrome. We need to talk about trauma. And we cannot let stigma and discrimination get in the way, because that causes people to suffer. So let's break down these stigmas so people don't struggle in silence. So there are people who are watching this webinar. This might be helpful for you to help somebody else recognize signs and symptoms, or it could be read for yourself. But I think the key for this mental health month is no one struggles in silence. So the good news are there are skills and techniques to be able to manage. Now, although I'm going to just give an overview of skills and techniques, it is important that if you need to meet with a mental health professional, a pastoral counselor, that you reach out. And so I'll talk a little bit more about that. So when it comes to stress, living a stress-free life is not a reasonable goal. The goal is to deal with it actively and effectively. So part of dealing with it is called coping. Coping is a process in which the individual manages the demands of the person-environment relationship and the resulting emotions that are generated from the situation. So there's two types of coping strategies. There are emotion-focused strategies that focus on the internal, and then there are problem-focused strategies that are action-oriented. So when I go back to that question, wilt thou be made whole? The first step is to answer yes and focus on the internal, but also now needing to take the next step, being action-oriented and getting up and walking. So first step from a first strategy from an emotion-focused strategy is emotional disclosure. You gotta let the Pepsi out of the Pepsi bottle so it doesn't explode. You gotta let that pressure out from internally. And this involves those strong emotions by talking about them with someone, writing about them. That's where a journal can be a great strategy. Writing a gratitude diary, journal writing for insight and process. But when we talk about talking about your emotions, what's really important is to own your emotions. Everybody has positive and negative emotions. Let's not suppress those emotions, because suppressing or stopping those negative thoughts or emotions over an extended period of time compromises the immune system. So it's really important not to compromise your immune system, because that can lead to poor physical health. That can get in the way of your total health and wellness. So it's really important to own your feelings, understand what's behind the feelings, and being able to talk about those feelings or journal about those feelings. Sometimes when you are being triggered by stressors or traumatic experiences, the trauma of the news, you got to take a break. You got to have a distraction. So another technique is having a distraction, a temporary distraction from what is going on. Keeping yourself busy to take your mind off the issue. Give yourself a little bit of a break. I'm a true believer, praying for guidance and strength, engaging in meditation, using mindfulness skills and paying attention to how you're feeling, promoting positive self-talk. That is so key. There is this whole idea of automatic negative thoughts. So when there is a lot of stress going on, when somebody is experiencing trauma, it is automatic that people will have those negative thoughts. They'll engage in negative self-talk. So part of the process is one, notice your patterns of negative, irrational thinking. Pay attention to how much time you focus on the negative versus how much time you focus on the positive. Become aware of how much you engage in that negative self-talk. And now you're going to have to be intentional, action-oriented to reframe how you're thinking. And that's where that gratitude diary comes in. And I think it's important. You could spend 90% of your time on the negative and forget about the positives that are going on. So you have to be intentional in reframing how you're thinking. When it comes to problem-focused strategies, to alter a stressor, this is where you're going to be action-oriented. This is where you're going to use your problem-solving skills. But what's key about this is you don't have to do it alone. We're not designed to be on an island alone. So now with problem-focused strategies, you might have to expand your social support network. You might have to enlist in somebody who can help you with coming up with problem-solving strategies. I will also say manage your time. have short-term goals and medium-term goals. I'm a true believer, the more we get caught in the future and future-oriented, that's going to increase anxiety. So it's really important to work on and being mindful of being here and now, because right now we don't know what's going to happen as a result of this pandemic. So as you're catching yourself so much further in the future, bring yourself back to the here and now and just try to manage the time that you have in the here and now. I like what the CDC had put out about 10 tips for managing stress during the COVID-19 crisis. Talk. This is where just because we have social distancing doesn't mean that you have to be isolated. We are using virtual communication, social media now. So sometimes people are on social media all day or Zoom and you need a break, but just remember that social distancing doesn't mean social isolation. We all have challenges and limitations. So accept your limitations. Don't beat yourself up. Give yourself grace and mercy. And for those limitations, this is where you might have to use your support network to be able to build your limitations for them to become strengths. I talked about meditating and mindfulness. Exercise, go outside, go for a walk, do the things you enjoy during non-work hours. Improve sleep, get more rest, hydrate. And hydrate with water. It is really important during this time that you really drink lots of water being at home. So make sure that you hydrate. For people that have pets, pets are therapeutic. So really understand the power of pets. Reconnect. So I talked on number 1 with talking and virtual communication, but reconnect with people you haven't talked to. This is a time now to reach out to people that you haven't talked to, because there is more time to be able to do that. I talked earlier about a temporary distraction. Take a break from the news. You can't be on the news 24/7. You can't be watching the news and going to the websites for the newspapers or the TV. And then again, talk to someone, and I'll kind of give some resources, but if you need to talk to somebody professionally or talk to somebody at the church, take advantage of using that, because you're not alone and we need to be able to help people and help you with not suffering in silence. Lead a balanced life. So if we go back to the beginning of the presentation, I said, wilt thou be made whole? So part of leading a balanced life, total health and wellness, is really attending to all the dimensions of wellness, whether it's your career, your physical, your emotional, spiritual, social, but you're going to have balance. And if there's something going on in one area, you have to know that it's going to impact other areas of your life. So you're going to have to really be mindful and intentional in trying to manage and balance your life. Understand, as I said earlier, personal strengths and challenges and limitations. And I can't help but to reiterate, I have it again, expand your support network. You are not alone. I talked about setting short-term and long-term goals, managing time to include quiet time. And we look at this pandemic as a crisis situation. The Chinese have a symbol for crisis that could mean danger, or it can be an opportunity for growth. When we are in this crisis, try to delay major and important decisions, okay? And also try to use this time as an opportunity for you to grow in other areas. Drink responsible and in moderation, and give yourself rewards. My reward system is, okay, I've done my work. I have checked in with some people. I have made sure I took time for myself. Now I'm going to sit down and binge watch Netflix or Hulu or something to just give myself time. And then also just make sure that you pay attention to what gives you meaning. And then as we come to an end, this presentation is a part of the Mount Ararat Baptist Church at the Mount Ararat Counseling Center. So you can reach out for support at the Mount Ararat Counseling Center. You can seek treatment from a mental health professional. Many of us clinicians now are providing telehealth counseling, and so you can look for a counselor through Psychology Today. You can look at their bio and see if they have criteria that you're looking for. Now, we talked about suicide, and if anybody has thoughts of suicide, has a plan, we have the Suicide Prevention Lifeline, and that's 1-800-273-TALK. And then we have the crisis text line. I know that a lot of people use their phone and text. So the phone number for the crisis text line is 741-741. And you would just text hello. And for both the suicide prevention lifeline and the crisis text line, they are 24/7. For people that are in Allegheny County, there's Resolve Crisis Network. And then there is the National Crisis Network hotline as well. So just know you are not alone. And as we come to an end, the question is, wilt thou be made whole? So with that in mind, I will answer any questions that people may have, whether you're on Zoom or whether you are on Facebook Live. So does anyone have any questions? And I saw that, yes, Darnell, that is actually correct. For those of you at your job, if you have an employee assistance program, you can utilize your employee assistance program. Utilize your employee assistance program. Well, if no one has any questions, utilize your employee assistance program. If no one has any questions, then I guess we will go ahead and end, and you can reach out to me at the Mount Ararat Baptist Church Counseling Center, or you can reach out to me via email, Tinsley, TTINSLEY at mount-mt-ararat.org. Thank you all for watching today, and I hope this information was beneficial. Have a great day.